Do you have a masculine face with a pronounced brow bossing? Are you looking for a procedure to reduce your brow bone so that the forehead flows smoothly into the nose? Well, you need a brow bone reduction procedure. The forehead can be considered one of the most readily apparent markers of gender. Contouring of the forehead with brow bone reduction can be a very transformative procedure and is a common feature of surgical facial feminization in Asia. During this video, we will discuss everything related to brow bone reduction, such as indication of it, how is it done, and expected results of this operation. Hello everyone, I'm Queenie from CloudHospital TV. In this video, we'll talk about brow bone reduction operation. And before we start, please subscribe to our channel so next time you'll be updated with our new releases. So let's start with what exactly is brow bone reduction surgery. Brow bone reduction can also refer as forehead contouring. It's an effective procedure capable of transforming a prominent forehead into an average feminine range. A male forehead has a more pronounced ridge of bone immediately above the eyes, known colloquially as the brow bone. A feminine forehead has a softer look. This approach is one of the main facial feminization surgery procedures. The forehead feminization includes remodeling the frontal bone by shaving the supraorbital arch and all the protuberance of the frontal bone. At the level of the eyebrow, a technique is performed to uncover the entire face of the frontal sinus. Remodel it and then place it again once shaved. Now let's talk about the types of brow bone reduction. There are 4 forms of brow bone reduction that surgeons often use depending on the prominence of your brow bone, the thickness of your frontal sinus wall, the size of your sinus, and the forehead in general. Type 1. Shaving. Certain individuals have a relatively smaller sinus and a broad frontal sinus wall. In such a situation, the surgeon will burr down the extra bone. Most surgeons today will only burr away a little amount of the bone, a process known as feminization of the forehead. It is usually impossible to turn a pronounced forehead into typical female range through burring alone. This is due to the frontal sinus. Type 2. Shaving and filling. This approach is often used by surgeons who do not conduct forehead reconstructions. It is effectively useful if projection angle in the nose and the brow is already satisfactory. In this scenario, just a concavity at the back of the bossing needs to be addressed. Bone cement will be used to cover the concave space on the top of the bossing. Type 3. Forehead reconstruction. The most commonly used forehead recontouring technique is the Type 3 procedure. The procedure involves detaching the front wall of the frontal sinus bone to remodel it and placing it back. Sometimes it is necessary to use a combination of forehead reconstruction and some filling with bone cement to get the desired forehead shape. Type 4. Forehead reconstruction and filling. To achieve the desired forehead profile, a combination of forehead reconstruction and bone cement filling may be necessary. Surgeons use bone cement to obtain the results that one wishes to have. How brow bone reduction surgery improves overall appearance? You can feel that your brow and forehead regions are too wild or prominent. This causes an overhanging impact on the eyes. In trans women and cisgender women, the forehead reduction procedure enhances the facial outline. This is by giving a more harmonious and womanly flexibility with how the bone aesthetically correlates with other features. The operation also shaped the forehead as well as the facial bone in the eye socket. This reduced the bony ridge around the excessively prominent forehead. So, who's a good candidate for brow bone reduction? You might be an ideal candidate for brow bone reduction surgery if you are an adult, have excess protruding brow ridge or a forehead that makes you look more masculine, wish to modify their male characteristic and crave for feminine forehead appearance, have an even forehead surface or protruding regional bone. Thank you for joining us in yet another video with CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible. 수고하셨습니다.